Hello people. So let us start off with general pharmacology topics. Let us start off with routes of drug administration. Okay. Now, what exactly are we trying to talk about here? So the route in which the drug has to be given, like you want to give a tablet and tell the patient take it, and no problem. You will let the patient decide to take it, or you will give an injection and send. What is it? How do you want it? Okay. Let's come to the exact classification, routes of drug administration. It can be local or systemic. Local means part of the body it will work on. Systemic means general action, maximum part of the body it will reach. Okay. Now, local can be topical, like a topical cream like this, and you should give examples for this. Like, what would you give as a topical cream? You know this betadine ointment that you get, povidone, iodine, you know those kind of topical creams, you get povidone, iodine, betadine. Then lidocaine, even local anesthetic you can get. Then you can get lot of creams you can write, okay. Then coming to deeper tissue like injection, like to a joint space an injection can be given and this drug will act locally in that joint space. So that will also be local, okay. Then you can give, what is the example for that? Like hydrocortisone acetate you can inject into knee joint. Are you awake? We're talking about an injection into the joint space. Moving on guys. Just a small wake up call. You're awake, right? We have finished intra-articular injection. Now we are moving to intrathecal injection. So that also can be done. Local anesthetics can be an example. Then intra-arterial, like to the artery they will give injection, like in femoral artery or brachial artery. So if there is malignancy or something, they can give anti-cancer drug to that local part, okay. Then in angiography also they will choose intra-arterial injections, okay, for contrast media. One thing you should understand, these kind of sprays, right, which are indicated like this, these kind of sprays where you can give salbutamol, etc. Those will be local action only for bronchodilation. It may have very little systemic effect. The effect that we want to achieve is actually local. Okay. Now in systemic, let's move on. Systemic, like there are a lot of different types of classification. People are not sure what comes. So we will try to understand systemic now. Systemic means basically it will be generalized in the whole body. Maximum part of the body it will reach. Some parts it may not reach like CSF, etc. But that's a different issue. So maximum it will be generalized kind of a treatment. So here you have enteral and a lot of other things and parenteral. Now enteral means it goes via the intestine. So the best example would be a oral, okay. Now oral, what happens is there is first pass metabolism, like you already know. It has to pass the stomach, then the intestine, then go to the liver, get metabolized. From there it has to reach the blood system if any amount of drug is left. So the bioavailability will be very less. First pass metabolism is more for oral drugs, okay. This is a very old mode of administration. It is safe, it's convenient, it doesn't need assistance, it is non-invasive, it's painless, correct? And what else? It's cheap also, okay. So here you can have tablets, capsules, lot of things. Liquids also you can have. What are the disadvantages that you can think of oral route? Basically, first pass metabolism, it is slower, because it is not directly reaching the blood, right? So it's going to be slow. It may cause nausea, vomiting. You cannot give it in uncooperative, unconscious patients. Then that's all, right? Sometimes it may taste bad. All that you can write. Examples you have to give, guys. If you don't give examples, no marks. So tell the examples for oral. Definitely you know so many. Paracetamol, yes. Amoxicillin, clavulanic acid, yes. Then what else tablets have you taken so many days in your life? Write all that. Okay. Now let's move on. Sublingual. Sublingual means people will keep it under their tongue and basically it is going via the buccal mucosa. See, one thing is sometimes they say parenteral means it is not via the mucosa and everything else will be via mucosa. A lot of confusion there still. But anyway, sublingual, you can either say it is enteral or you can say it is not enteral, whatever you want. You say sublingual, under the tongue. it will be going via the buccal mucosa, and only lipid soluble non-irritating drugs you can give, and the taste also should be taste also should be good. The absorption will be rapid, okay, and this is kind of inconvenient, but the person can spit the drug after the desired action he has achieved. Example of the drugs which are going to be in sublingual: glyceryl trinitrate and all that, okay. So if the person is thinking he's having angina, he can use glyceryl trinitrate. Then moving on, guys, rectal. Now rectal, it is called as a suppository, right? It is going to be put into the rectum. This is kind of a very unpleasant, it can be very embarrassing also to give this. So usually they give diazepam for convulsion for children, okay. They will put diazepam rectally. What else you want to write about this? It will bypass the liver, okay. So it is good only. Indomethacin, paracetamol also can be given rectally. There can be irritation and all that. Let's move on to the cutaneous one next. Inhalation. Inhalation we didn't cover. Okay, inhalation, let us cover. Inhalation, see what happens. Inhalation. Volatile liquids and gases can be given by inhalation, like general anesthetics. This is not the same nasal spray kind of a thing. Here it is systemic action, okay. Guys, wake up, we are discussing this, and here you can see here general anesthesia being given by inhalation route. The examples of these general anesthetics will be halothane. What else you know? Nitrous oxide. All of them can be given like this, inhalational route, okay. What you should understand is it will have systemic action, and you can control the administration. There will be rapid action also. So examples for systemic and inhalation type will be general anesthetics. Moving on, nasal. Nasal, no, like nasal route, but systemic they are talking about, okay. Some things like gonadotropin releasing hormone, desmopressin, all these have been tried via a spray or a nebulized solution, and that's all for now. Let's move on to cutaneous. Cutaneous, actually transdermal patch, okay. Now when it comes to transdermal patch, guys, this is the transdermal patch shown here. Actually you need to learn one diagram for the exam. This is the diagram of the transdermal patch. What and all you should know here. See, this is the film. This is the drug reservoir. There are micropores here. So this is a membrane which has micropores. Then there's an adhesive here. Then this is the skin which has a lot of capillaries. The thickness they have shown here of the drug reservoir is around just 0.2 to 0.4 mm. Okay. The adhesive will also have a layer of priming dose of the drug. Okay. This diagram you should practice. This is TDS, transdermal drug delivery system. What is it? It is systemic, right? And here what happens? Different patches will be there, different size, different shapes and all that. And they will have a drug, okay, a drug contained drug, and at a constant rate it will be delivered into the systemic circulation via the stratum corneum, okay. Then the drug which is bound to a polymer, okay, or it will be in solution, it is held in a reservoir. What else you should know? You should draw this diagram in the exam. Examples you should give. You can give glyceryl trinitrate, nicotine. You should have heard of all these people who want to quit smoking. They'll have these nicotine patches, right? So nicotine, GTN, that is glyceryl trinitrate for angina, etc., right? For those people. And lot of things you can give. Hyoscine patch, hyoscine. Have you heard of people who have motion sickness? They will put these kind of patches behind the ear. Scopolamine patch or hyoscine patch. So if they have motion sickness, they should apply that patch 4 hours before the journey, so that the vestibular apparatus, right, it will work on that and it will control the motion sickness. Okay. Are you awake? Shall we give a wake-up call for you? Guys, we are discussing transdermal patch or cutaneous route of systemic drug administration. Okay. Moving on. So now guys, it is time to move on to parenteral. Parenteral means something other than the intestine. So everything on earth actually should come under parenteral. So there's a lot of confusion, so just learn parenteral as these four. Subcutaneous, intramuscular, intravenous, intradermal. Most of the times it will be an injection. Most of the times, okay? So what exactly are these injections? Look at them. So here are the injections. Intramuscular, given like this, vertically, 90 degree. Subcutaneous, it's going below the dermis, subcutaneous. Intravenous, into the vein. And intradermal, into the epidermis. They will just raise a small bleb. The minimum angle you see here is an intradermal. Just go below this, into the skin, just into the epidermis and raise a bleb and give this injection. So you need to know the examples also, okay? Here you can see the bleb. Here's the bleb that you can see, okay? So this is transdermal. Sorry, what am I saying? Intradermal. Transdermal is the patch. This is intradermal injection. Parenteral, they are saying it is. Here you have the BCG vaccine, as soon as a newborn baby, they'll give this type of vaccine, BCG. Tuberculin test, lepromin test, all of these are intradermal, okay. Now, why do you think they choose parenteral route of drug administration? Because here, there is 100% bioavailability, especially intravenous. Intravenous 100% bioavailability. You can give it in emergency, you can give it in comatose patients. Then the liver is bypassed, 100% bioavailability, already told you. Then uncooperative patients, if they are vomiting, etc. What else? The disadvantages are like you need skilled people, then you need sterile environment, you can even introduce an air embolism which could be fatal, etc. Local tissue can be injured, then it's risky because suddenly you might inject something wrong and the patient can even die, right? Hello, is it going too much above your head? We are discussing parenteral routes of drug administration and we are currently discussing the advantages, disadvantages, etc. So let's quickly look at the examples and wind up. Subcutaneous injection, insulin. Don't forget, these people take insulin injections. Then you have dermojets like this one, where it's not exactly an injection, but at a force it is sprayed and it will go and deposit into the skin. Then you have pellets. You can give steroids and testosterone in this way, pellets. Implants. Like this one, for contraception, they can use implants. Intramuscular injections, you should know, like adrenaline in emergency, they will give intramuscular injections. Streptomycin is a antibiotic, intramuscular. Guys, if you go by the systemic parenteral, actually if you go by that injection angle, intramuscular 90 degree, then subcutaneous, then intravenous, then intradermal. So we'll just arrange it according to that. Now let us move on to intravenous. Intravenous, very important, guys. Very, very important for exam also. They'll ask the advantages, disadvantages, everything. Intravenous, you should know 100% bioavailability because you're directly injecting it into the vein. Correct? Intra-arterial was what? It was local. But intravenous is going to be systemic because it is going to take all the blood to the heart and from the heart to the whole body. So intravenous is going to be an injection into the vein. Examples of the drugs here would be sodium nitroprusside. Okay, sodium nitroprusside is sometimes immunoglobulins. See, immunoglobulins can be given intramuscular, intravenous anyways. And gentamicin is intravenous. Morphine is intravenous. So if a person is in extreme pain, they give morphine, that is intravenous. Okay. Then coming to last, intradermal. Intradermal also will be injection, like you saw, 10 to 15 degrees just into the epidermis. BCG vaccine, tuberculin test, lepromin test, etc. Now guys, there is one more thing to cover here. Unfortunately, this is not over yet. Okay, there is something called as newer drug delivery system which has been asked in the exam and you need to know it. So let's add a slide here for that. Newer drug delivery system. Awake, right? So we will just name it, you can understand. These are developed to improve the drug delivery, okay, more targeted for better patient compliance, etc., prolongation of duration of action, etc. All those, you can write all those fancy things. Okay. So, examples you should know: Ocusert for the eye, Ocusert for the eye. So, pilocarpine Ocusert, you can know that. This is how it looks, guys. Then Progestasert, you should have heard of that. Progestasert. It's an intrauterine contraceptive device, and it will produce controlled release of progesterone, right? So Progestasert. Actually, all this has not even been mentioned in those route of drug administrations, like IUDs and all. They are not mentioned only, right? Correct. No wonder. You should write all this in the exam. If they ask you routes of drug administration, you should write this also. IUDs and all that. And then stents. Stents, guys. Stents. Stents means like polymer containing drugs. There will be metallic stents. These devices will slowly release the drug. Angioplasty, for coronary angioplasty they will use. But these are very costly. They are used basically, for antithrombotic agents. Next you have something called as prodrug. Prodrug is, instead of giving the drug itself, they'll give the inactive chemical derivative, that is a prodrug, like levodopa. So, here what happens, the actual drug, it will not be able to cross blood-brain barrier like dopamine. So, they'll give levodopa, so that it can, go to the actual site and work. There are a lot of other things also. Many other advantages are there of giving a prodrug. There will be less side effects, less toxicity. Then, what else? It will be more stable. A lot of things, okay? But the only disadvantage is the body will have to activate it. What else, guys? A lot of other things, guys. It's not getting over only. What can I do? Computerized miniature syringe pumps. Some computerized miniature syringe pumps. Insulin can be given like this. Okay, insulin, nitroglycerin, GnRH, right? That is gonadotropin releasing hormone. Where else did you see this GnRH? A very weird kind of a route drug delivery system it has, GnRH. Nasal spray, guys, GnRH, interesting. So GnRH can also be given by that computerized miniature, this one, computerized miniature syringe pumps, okay. Last one is targeted delivery. Targeted delivery. Targeted delivery, like monoclonal antibodies. Not very sure, but definitely it's a very targeted type of monoclonal antibodies, liposomal drug delivery, etc. Not going into much of details, but there are a lot of newer drug delivery systems. You will have to know these. Ocusert, Progestasert, stent, prodrug, computerized miniature syringe pumps, targeted delivery. Remember, prodrug is also a drug delivery system. Stent, all that you will write, right? So let's revise what we have seen so far in this video. We started off with general pharmacology. Routes of drug administration can be local, systemic. Local will be topical. Then you can have intra-arterial injection, intrathecal injection, intra-articular injections, etc. Systemics can be oral, sublingual, rectal, inhalational, nasal, cutaneous like transdermal patch. Then you have parenteral, you can have intramuscular, subcutaneous, intravenous and intradermal. So don't get confused between transdermal and intradermal. Transdermal is a patch, intradermal injection. Examples can you tell for, let's ask, intramuscular, adrenaline, intravenous, come on, intravenous. Sodium nitroprusside, what else? Gentamicin, morphine, very good. Then tell example for intradermal. Intradermal will be BCG, tuberculin test, lepromin test, etc. Subcutaneous will be insulin. Very good. Then can you tell example for what else? Oral very easy. Paracetamol, aspirin. Okay, very good. Tell example for inhalational systemic. Okay, general anesthesia, halothane. Then nitrous oxide. Very good, very good. Then what else? Transdermal patch, very important for exam. You will have to draw this diagram and also give the examples of the drugs. You will have to give examples like hyoscine, nicotine, GTN, etc. Sublingual also important. Sublingual you will have to explain GTN, etc. Rectal also diazepam, indomethacin, paracetamol. Oops, so much, right? Okay guys, I think let's wind up this video. This is enough for now. Hope you enjoyed the video. Come back and let's continue with the other topics. See you. Bye bye. And don't forget, there are newer drug delivery systems that also you have to write in the exam. Ocusert, Progestasert, stents, prodrug, computerized miniature syringe pumps and targeted delivery. Okay? Bye. Finally, bye bye.